This eHIV Review Patient Voices program is presented by DKB Med Radio. They're adolescents and young adults. They're growing, changing, making decisions now that will affect the rest of their lives, including protecting themselves against HIV acquisition, getting tested, and getting into care as soon as they become aware of their diagnosis. Today's edition of our Patient Voices program is a companion piece to the recent eHIV Review issues by Dr. Vincent Guilamo-Ramos, Professor and Dean of the School of Nursing at Duke University. Our guest host today is Justin Alves, one of our eHIV Review program directors, and he'll be speaking with Christian Laura. And now, Patient Voices.
So I just want to welcome Christian here. And Christian, do you want to take a minute and introduce yourself to everybody and tell us a little about what you're doing right now?
Yes, certainly. So my name is Christian Manuel Laura. I'm a medical case manager and I work at MGH Chelsea. I've been a community health worker for, I want to say, about a little over 10 years of experience. I've worked in a lot of nonprofits like Bagley, the Boston Alliance of GLBT Youth. I've worked for Victory Programs. I worked for JRI. Justice Research Institute, and now I work for Mass General Hospital. So I've been around a lot of nonprofits.
Can you tell folks a little bit about the kind of work that you actually do in those nonprofits?
Yeah, so I started off doing a lot of LGBTQ focused groups. Like I started off doing outreach, just passing out condoms and doing workshops about sexual education, like STIs, HIV, and prevention mostly. And then I got more into like doing testing. So I started doing HIV, Hep C, syphilis, gonorrhea, chlamydia testing with Victory Programs. But I kind of started doing that at Bagley too, because we started moving a little bit closer to more public health stuff, like towards the end when I was working there. But before it was just like LGBTQ focused and just doing more of that. I moved over to doing the needle exchange over at JRI for the program Rise. And I was doing a lot of street outreach and as well as doing a lot of Narcan trainings, overdose prevention workshops. And also part of it was making a lot of the kits for safer smoking. So we had safer smoking kits and we had safer injection kits. And so I added one to the mix, which was a safer booty bumping kits. So these kits were pretty much similar to the safer injection kits, but just more catered towards booty bumping because essentially they're very similar. But I got that under my belt. I created that booty bumping kit. When I was at Victory Programs, I actually created my own HIV and PrEP workshop when I was there. And I believe they're still using that workshop till this day. It was like with a bunch of pictures of like the different body fluids. And there was like, does this person need to go on PrEP? Does this person, like kind of like one of those scenarios that I fit into like one hour. I've done that. I feel like I've done a lot of work and try to introduce new things to the world of prevention, harm reduction. And now I do medical case management at MGH. So I mostly do viral suppression, so not much of prevention work.
And so, I've known you for some time now, and I'm wondering if you can share with folks a little about how your personal journey and your professional journey working with HIV sort of come together for folks.
Well, I was out since I was when I was 14. So I was LGBTQ stuff, youth stuff was how I kind of started everything in my career. But I started doing more like primary prevention work and helping out people who are more at risk for a lot of things like infectious diseases and overdose. I feel like, I was able to share my own experience with a lot of the clients that I work with. And it was because when I was 21 years old, I was diagnosed with HIV. So I was able to really introduce HIV as a way of saying like, hey, like it's not the end because I'm living proof of someone living with HIV, but also it when I was introducing PrEP to a lot of people, I kind of had my own, I guess, agenda because I wanted PrEP to be always known as a way to fight stigma.
So can you take us a little through what your life was like? You said that you think of PrEP as this way to fight stigma. And so I'm wondering if you can talk about, sounds like maybe you experienced some stigma in your life.
Yeah, certainly. So I've been living now with HIV for 9 years, almost 10 years now. And it's been a struggle for me, to say the least. Like I feel like, we live in this age of PrEP now, and people are, a lot of people are on PrEP. Everyone on Grindr is on PrEP. This person's on PrEP. That person on PrEP. This couple's on PrEP. Like it's so common right now, and but in my experience being HIV positive, I've been experiencing a lot of stigma even from PrEP users. And PrEP was originally meant for a way to not discriminate with people who are HIV positive. Um, and I mean, I have nothing to really worry about in terms of transmission because I've been undetectable since 2016. So, and I was diagnosed in 2014. So there was a very small period of time where I wasn't virally suppressed. And I feel like it's, even when I tell people like, that I'm undetectable, I still get treated like, I still get stigmatized. Like, and I've deleted like apps like Grindr because it was not good for my mental health. I feel like it, like just dealing with all that negativity, that rejection, instant blocking, or people just not replying back, or I feel like it was just messing with my head. So I'm I feel like it's, PrEP is this fun thing. Everybody's enjoying themselves, but people like me who are HIV positive don't get to enjoy the fun.
I'm wondering if you can talk a little bit about, you said you were diagnosed in 2014, you became virally suppressed in 2016. What was it like in the beginning when you were diagnosed? Was it easy for you to get into care? Did you struggle finding a place you felt safe or comfortable, or what was that experience like for you?
Well, I was diagnosed at the beginning of me being 21. So my birthday was in March, and the very next month, I was diagnosed with HIV. Um, and I was actually trying to go on PrEP when I found out my diagnosis. So it was a major shock for me, especially because I was always the type of person that always used condoms, and PrEP was still very new at the time. And I thought it was like unsafe. Like I thought it was scary because I didn't, it's not like now where like, there's so much tests now. Like we know that people, like we know the risks now, like people do know more stuff about it, but we didn't know about it that much in 2014. It was still like this new thing. And I always still used condoms back then, but I had one experience where the guy that I was engaging in sex with did not took off the condom in the middle, and there was no ejaculation or anything, so I thought I was safe. And I always routinely, like I will always get tested all the time. I've been getting tested since I was sexually active, since I was 16. So I really didn't think much of it because I thought like no ejaculation, no transmission. And I've already known so much like in terms of risks because I worked in in places like Bagley. So when I found out these news, I felt disappointment, I felt embarrassed, I felt humiliated, like, because especially for someone like me that knows everything, how can it happen to me? And yeah, they told me it was too late to go on PrEP. So, and I feel like I was like just turning 21. I was finally able to go out to the clubs and start drinking and, just being free. And that really ruined a lot of stuff for me. And it took me a while to even go on treatment. I didn't even want to hear about HIV. Like, I was in denial for the first couple of months. But what I wish that someone would have explained to me even before I got that diagnosis was that you were going to be okay no matter how this test is going to come, because now people can live with HIV. Like, I feel like people wait too long and say that after, but you're really supposed to say that before. One major factor that I noticed is that people who are on PrEP, they've all had some high risk experience. The only difference is that in that a high risk experience, the people who get a positive diagnosis aren't so lucky, and the people who do get a negative diagnosis, they get on PrEP, and they get lucky. And that's why I feel like it's very important to start sharing the new information, like undetectable, like you can get into undetectable, like that should come within that, because at the moment I got my news, anything that they said to me was not coming in. Like, I shut down it, like, because I was in so such disbelief of that was overpowering my whole emotions.
Yeah, I mean, as you're talking, right, I think we talk a lot about barriers that keep people from PrEP and barriers that keep people from care. And you're talking about the denial, the shame, the humiliation that you felt, right? And I'm wondering, are there things today that could be different, that would have lowered those barriers, that would have made it easier for you to come in earlier for PrEP, that would have made it easier for you to get on treatment faster? Like, what are the things that were major barriers for you? Beyond the stigma is clearly huge, right? You've talked about that a lot. But were there other physical barriers or other provider barriers for you coming in?
Treating, I mean, HIV, of course, is, it's a chronic illness. It's you'd have it for life. Like, but I feel like people still treat HIV like a very scary thing. And then what kind of kept me, like, I could have gone on post exposure, like after that experience, like I've known about that. But even it's not, I don't even think like it's about the knowledge. Like, now that I've been, thinking about it, like, it wasn't my knowledge, but I feel like a lot of it has to do with the way we treat HIV, because the way my mind works is that I try to ignore it when something's scary. Like, some people could prevent themselves from getting tested for a long time because they rather just forget about the idea. And I feel like that's what I was doing. So the way that we continue to treat HIV the way that we do, it's I feel like it needs to be treated more like it's, you know, like, let me get this treated like right away, like the same way we treat gonorrhea or chlamydia or syphilis, like, going straight to a treatment. I feel like knowing the possibility that you may in fact be HIV positive, but it's okay, like you can get treated for it, this and that. I'd rather just get all that through it, because I know because it just seems like HIV is like this deep, dark hole. Like, you don't know what's going to happen once you get that diagnosis. You don't learn that until after you start, the treatment. I feel like people, like even people on PrEP, should always know that this is a possibility. And the more that we treat it that way, the more that we, because I'm noticing with PrEP users, they have a complete blind side to all the new knowledge about HIV.
So when you say like making it easier, right? Like I think about where we treat gonorrhea even, right? Like in the primary care setting and how we have walking clinics and things like that. Are those the kinds of things that you're talking about, like to make it easier for folks at risk and living with HIV?
Yeah, like I feel like there's there's not much. So like I've known how to get treated for gonorrhea, chlamydia, or syphilis, like what those procedures were. And I didn't have to have one of those diagnoses, but I knew what it would happen. You know, you'll take a pill, you'll get a shot, you know, all this and that. I feel like a lot of people just don't know what happens if you have HIV. Like there's just like this blinded knowledge like there. And I noticed that with people who are in PrEP, like they just absolutely have no clue. And I feel like in a way it's because, you know, we treat HIV as like, oh, well, that doesn't matter unless if you have it. So, um, because even when I get work with people who are like newly diagnosed, they really don't really know like what the procedures are.
Hmm.
Like, you know, what is viral suppression, what is undetectable, like none of that. It's all blind knowledge. It's knowledge that it has been out there but people just don't know about it. Um and it's disappointing to see that people who are in PrEP like not know any of this.
So when you work with somebody who's newly diagnosed, what are some of the things that you do to try and make it easier, to try and reduce those barriers to help people out?
Like one of the things I do is share my status, like share my own experience. And in a way, you know, I tell them it's going to be okay, because for a lot of times it's you just don't know. Like there's just this big unknown. So I always feel empathetic, because I know that emotion, that when you get that diagnosis, you really don't know what's going to happen from here.
So that having somebody else sort of with the same lived experience, like trying to be like a role model in a way for folks who are coming
Yeah,
in.
right.
Okay. And, I'm wondering, do you prepare people for, or how do you prepare people? You've talked a lot about the stigma that you faced living with HIV, deleted the apps. How do you prepare folks who you're working with or work with people just regularly to manage some of those feelings around the stigma?
I Well, I do a lot of groups in my spare time. I actually help organize a Latin or Spanish speaking group called the Latin Wellness Center. So that's like a support group for LGBTQ people, and we usually meet like every once a month or every 2 months, and that's that's something I like to do, like doing type of groups. I also go through like the Thrive Dinners by JRI, which is designated for HIV positive folks. So I try to stay connected with people, and share with events with my peers. And I also take therapy like weekly, so that always helps me. But because I feel like a lot of people don't really talk about it, but it's like, or believe it's true. But when you have that diagnosis, it's like a trauma. And some people wouldn't consider it trauma, but it really is a trauma. Like I call it HIV trauma. Like it's, when you get tested, and you're sitting there and you get a negative result, you get this sense of relief, you get this, oh thank God. The difference is when someone gets a positive result, they don't get that relief, they get choked. It's like, and like, this is it moment, like. So I feel like that's what I deal with on my own. And yeah.
So I think that analogy, Christian, is really powerful to talk about the sense of relief versus that sense of like being choked. I'm wondering, as right, like I'm a provider, I've not been diagnosed. What is something I should know or do to try and like take the fingers off someone's neck? How do I try and provide that relief? What do you think would be good for our audience to know?
Well, like I mentioned prior, like I feel like um just knowing prehand, like what is to happen, like, because if a person, like, for example, one of my patients actually was they got diagnosed because they didn't take their prep adherently, so they just like missed doses. But I feel like when PrEP users who aren't using condoms, and it's already evidently when they get gonorrhea, chlamydia, or syphilis diagnoses, when it ever comes to that time where they do get an HIV diagnosis, they should know prehand what undetectable is, what virus suppression is. Like that shouldn't be introduced later on when it's already like when they find out their diagnosis. Because what I always realize happens to a lot of newly diagnosed people is that they disappear for a while. And I was one of those patients that disappeared for a while. Like I was nowhere to get contacted. Like I isolated myself in healthcare. Like you don't want that to happen with newly diagnosed patients, because that's going to happen a lot. And that's why you always have to prepare like PrEP users, high risk people, always prepare them to know what the process is of viral suppression undetectable, or what could happen if you don't go on treatment. I feel like knowing that prehand, it's important, because otherwise, once you get that choke moment, you're not even receiving new information.
So really an onus on the responsibility of the person ordering or doing the HIV test, right? Like if you're going to do a test or ask for a test or help a patient with a test, like really going through, what does that mean? What could be the results? What are we going to do? Depending on what the results are, right?
Right. So I feel like knowing like that shooting more, because people see HIV as this very scary thing. It should be more important to talk about it more as a chronic illness, because it is going to be something that you're going to have to manage later on. And I mean, for me, it's not really hard to manage. I've noticed for some people it's easier than others, but I feel like, especially for someone who may be, might have to take something for their blood pressure, or someone that has asthma, or someone that has who's diabetic, like, they deal with a chronic illness. So I feel like you just, kind of putting that into people's thought process that HIV is a chronic illness, but not like this big scary, thing. And I feel like a lot of the language with PrEP sometimes still treats it as HIV, as this big scary thing. So, but yeah, I feel like the way that gonorrhea, chlamydia, syphilis don't get stigmatized, HIV still gets stigmatized like a whole heavy lot. And I think it's because we're not talking about like what happens if you get HIV. Like this is what the reality would be like.
Yeah. So I guess my final question for you is, I've talked with a lot of different patients myself over the years on this podcast before, and they talk about living or thriving with HIV. And so I guess my question to you is, what are some things that you do to really avoid stigma, to combat stigma, and thrive with HIV? You're one of the people who I think about, honestly, like you thrive with HIV. I think you do a wonderful job. I think you really have found this niche. And so I'm wondering if you can offer something up to other patients, even providers who might be trying to help their patients figure it out.
Yeah. Well, I feel like it's all around PrEP right now. And I feel like it's, PrEP is great, but I feel like people don't know what U equals U means. Or in Spanish, it's I equals I, E is igual a E. Like I'm wearing the shirt with I equals I. So I like to show like I like to subtly just show different things. And I think that, it's important to recognize what it is to be undetectable, what it means to be virally suppressed. I feel like there's not enough of it. and it's kind of like ingenuous to a lot of people who, you know, are thriving, because I'm not the only person that's thriving. I mean, I guess I just make myself more visible, but I'm hardly like unique. I just like, I'm just on social media and stuff. So yeah, but I mean, even like on my social media, like I never actually disclosed about my status, but I like to still show awareness about like what undetectable means. Or in Spanish, I do some TikToks in Spanish explaining indetectable. And I just like to, you know, put the knowledge out there, and, you know, just talk about, you know, the different days, like National HIV Testing Day. And I even do videos about talking about stigma. And yeah, like I like to always have conversations with people.
So I just want to thank you so much for being with us today, Christian. I think you're an excellent example of someone who is thriving with HIV, and you've shared a lot of really good information for providers, and I think a lot of patients. So thank you so much.
Thank you, Justin. Thank you for having me.